Hello again, everybody. For those of you who are not aware, my name is Tanner Lapointe from the Schizophrenia Society of New Brunswick. Today, we're going to be talking about what is perhaps one of the most misunderstood mental illnesses of all, bipolar disorder. So what exactly is bipolar disorder? Bipolar disorder is a mood disorder. It is caused by a biochemical imbalance in the brain. It is characterized by mild to severe mood swings such as depression, mania, and hypomania. Typically, when someone has bipolar disorder, they will experience episodes of mania, which are the extreme highs, and depression, which are the extreme lows. Let's talk about some of the symptoms of mania and depression. So the symptoms of mania: high energy, persistent elevated and aerobic mood, excessive talking, lack of sleep, promiscuous behavior, loss of ability to control impulses, excessive spending, aggressive behavior, and feeling grandiose. These are some of the symptoms associated with mania. So the symptoms of depression: excessive feelings of sadness, lack of energy, deterioration of memory, somatic pain with no clear medical cause, and thoughts of suicide or death. These are some of the symptoms associated with depression. So somebody with bipolar disorder will experience extreme lows, known as depression, and extreme highs, known as mania or hypomania. Hypomania is just less severe than full-blown mania. Unfortunately, there is a fairly common misapprehension out there that somebody with bipolar disorder will manifest certain behaviors such as being happy one second and the next second being very angry and irate. In most cases, this is not accurate. Those types of mood swings are actually more consistent with other mental illnesses, which we will discuss in subsequent videos. So you can think of bipolar disorder as experiencing extreme lows and extreme highs. These highs and lows last over a period of time, such as days, weeks, or even longer. So what exactly causes bipolar disorder? Like most disorders, there is no one specific cause we can point to. However, there are certain factors that may contribute. Let's talk about some of them. So some of the potential causes for bipolar disorder include a genetic predisposition, which is a family history, so somebody in your family was had bipolar disorder, organic brain malfunctions, a pre-existing endocrine disorder, stress and trauma, excessive use of defense mechanisms, and excessive substance use. Of course, this is not an exhaustive list, these are only some of the potential factors. How exactly is bipolar disorder treated? Bipolar disorder is often treated with medications. Let's talk about some of the medications that may be used. The most common type of medication used in the treatment of bipolar disorder are called mood stabilizers. Mood stabilizers work by decreasing abnormal activity in the brain. Many mood stabilizers fall into a class of drug called anticonvulsants. Anticonvulsants are used in the treatment of seizure disorders, but are also used as mood stabilizers. Some anticonvulsants that may be used in the treatment of bipolar disorder include Epival and Gabapentin. Other drugs that may be used outside of anticonvulsants include lithium as well as others. Other forms of treatment for bipolar disorder include some psychosocial interventions such as group therapy and cognitive behavioral therapy. So I would like to thank you all for taking the time to watch this video today. I hope it was very helpful and informative. For your benefit, in the description I have included some various contact numbers if you are looking for help. Please remember, however, if you are in crisis, call 911 or proceed to your nearest emergency department as soon as possible. I have also included links to various agencies if you are seeking more information about these topics. Please stay tuned for our next video where we'll be talking about borderline personality disorder. Thank you, everybody. Remember, recovery is expected.